Hello. Can everyone hear me? I hope everyone can hear me, right?
Yes, yes.
Okay, good. Thank you.
Hello.
Sorry.
Hello, hi.
Can everyone hear me?
A bit
I
technical
hope
problem.
everyone can hear me, right? Okay, good. Thank you. Sorry. A bit technical problem. Hi. Hi, everyone. Good evening, everyone. Sorry for and he actually obtained his master in ophthalmology as well as he was a head of 2004. Dr. Lim is also a very highly experienced and competent surgeon for cataract surgery with wavefront, toric or multifocal intraocular lenses. As well, he is also practicing in LASIK, pterygium excision, and conjunctival graft using the fibrin glue, as well as the trabeculotomy surgery for glaucoma management, screen eye surgery, and eyelid surgery. At the moment, Dr. Lim, beside our resident doctor, he's also a visiting consultant at Perak Community Specialist Hospital. So without further much ado, I would like to, okay, let me stop share screen first. All right, so without further much ado, let's have Dr. Lim on the stage, and then Dr. Lim.
Hi, good evening, everybody. Okay, so I will share my screen with you all. Hi, good evening, everybody. Okay.
Dr. Lim.
Yes.
Sorry, tonight I think we have some quite a
Yeah.
bad internet problem.
Yeah, yeah.
So
It's a
I
bit
hope you
breaking
guys
up.
will be a bit more patient with us.
Yeah.
So yes, Dr. Lim, can see
Okay.
your slide.
Okay. So I'm going to start my slide now. I hope you all can see the topic, the red eye.
Dr. Lim, we can't hear you, Dr. Lim.
Can't hear. Okay, sorry. Wait. Let me see. Can you hear me now? Can you hear me?
You can hear? We can't hear you, Dr. Lim.
You mean the voice is breaking up, is it? Hello? Can you hear me?
Yes.
Hannah?
Can everyone hear Dr. Lim?
Okay. Can you all see my screen here?
If yes, can you please put in the chat room?
Can you
Yes, good. Thank you. Thank you
all hear me
very
here?
much. Thank you for responding. Good.
Okay, thank you
Okay,
very
Dr.
much.
Lim, you may proceed.
Okay, so actually tonight I would like to talk about the red eye. So I'm sure red eye is something that occasionally or sometimes all of us would have encountered in our own life. So you're probably wondering like what is the reason why is my eye red? Okay, so tonight I hope to be able to enlighten you all a bit on the different causes, conditions which may cause red eye. Some of it may seem a bit complicated to you, but some I think you can relate to everyday life, no? So let's have a look. So okay, common causes of red eyes. Yes, there's a lot of medical sounding terms here. So firstly, I think in today's setting, a very common cause of red eyes would be what you call digital eye strain. Sometimes they call it computer vision syndrome, and basically this leads to dry eyes, which causes the redness of the eye. Okay. So actually, all these conditions here, I will be talking a bit more detail later. Okay. So the other things are like contact lens related causes of red eye, and then you can have infection like infective conjunctivitis. You can even have allergy such as allergic conjunctivitis, and then you can have something called a subconjunctival hemorrhage. Then you can have inflamed pinguiculum or pterygium, episcleritis, or trauma. Okay, I will go a bit more in detail about all of this, so don't bother trying to memorize. Okay, less common causes of red eyes, things like corneal ulcers, scleritis, uveitis, even acute glaucoma, and then there's something called thyroid eye disease, which usually affects people with thyroid problems. Again, I will go a bit more in detail along with some pictures later on. Okay, dry eyes. Dry eyes, if the eyes are very dry, it can actually cause eye redness and sometimes even reflex watering. That means although the eyes are dry, sometimes the patient may say that, well, they feel that the eyes are actually watering. Well, this is actually quite a common symptom because sometimes when the eye is too dry, the eye will try to like protect itself by trying to produce more tears. So you may get a sudden increase in tearing even though it's dry. So other things are, of course, patients will feel that the eye is dry, feeling of dryness, sweatiness, or burning sensation. And this is typically worse on exposure to wind. So what are the causes for dry eyes? Well, there are multiple factors. Just now, firstly, I mentioned digital eye strain or computer vision syndrome. That means excessive use of all these handheld devices or computers and laptops. And then a very common factor causing dry eyes would be contact lens use. Okay, and then even things like menopause, hormone replacement therapy can also cause, may also be a factor in the dry eyes. Like during menopause, you may have a withdrawal of androgen. Androgen actually has a role in like preventing dry eyes. And then hormone replacement therapy, sometimes those hormones that they actually add in actually may, like estrogen, for example, it may actually make dry eyes worse. Okay, the dry eyes, how do you manage it? Generally, of course, the simplest solution would be we treat it with lubricating eye drops. Okay, but many cases of dry eyes, they have other associated conditions. Sometimes they may have a what you call this a meibomian gland disease. That means the oil glands at the eyelid may be inflamed or infected, and this can actually cause dry eyes to be worse. So sometimes in these cases, you need to treat not only with the lubricating eye drops, but you actually need to probably get a proper assessment by the doctor and treat the meibomian gland disease as well. And then in some rare cases, dry eyes may actually be associated with some generalized illnesses like SLE, connective tissue disorders, or even thyroid problems. So probably most of you have not heard of all these conditions here, but for those are very few who actually have these conditions, I'm sure they are very familiar with it. And it is known that in these conditions here, one of the most common symptoms is actually dryness of the eyes, dry eyes. Okay, just coming to a bit more detail for digital eye strain or the computer vision syndrome. So this condition is especially common in this age of technology, virtual meetings like now, and working from home. So the eye redness, as I mentioned, is mainly due to dryness. Now, when you look at a computer, automatically we tend to blink very less often, less frequently. So this leads to eyes drying up very fast because tears evaporate much faster if you keep your eyes open for a longer period of time. So this is one of the factors. So how do you avoid this digital eye strain? Well, if you can't cut down your time spent in front of a computer, then I think a good practice here is to remember what you call the 20-20-20 rule. Okay. So in this this little tip here, I would advise is that after every 20 minutes of looking at the screen, you should look away at a distant place about 20 feet away for 20 seconds. So that's why it's called 20-20-20 rule. Okay. So when you look at a far object for some time, this will give time for our tense eye muscles to relax. Okay. And then of course, if you're looking at the screen, if the screen does not appear clear enough, then you must wear the appropriate glasses, of course, to avoid eye strain. For the dryness in digital eye strain, as I mentioned just now, you can use lubricating eye drops or what they call artificial tears. Okay, another cause of dry eyes is actually related to contact lens. Contact lens is something I think is quite common. Many of us use it. So again, in contact lens related redness of eyes, the redness is main reason I would say is due to dryness. Okay, but that's not the only reason. Sometimes people use contact lenses, they may have a type of allergy called as a contact lens related allergy or giant papillary conjunctivitis, as seen in this picture here. So the eyes appear red and and if you look here, you can see that they are what we call papillae, all these elevated spots here. So this is actually a sign of a type of allergy, usually related to the contact lens use. Another cause of redness in contact lens user is something a bit more serious. It's called a corneal ulcer. So in this patient here, you can see the eyes are red And not only that, if you look carefully, you can see there's a white spot on the cornea here. Now, a white spot on the cornea and the eye is red. This usually means that it's a corneal ulcer. So corneal ulcer is actually an infection of the cornea. That means some bacteria has actually entered the cornea itself. Cornea is what we see as eye black. So actually, a white spot on the cornea is something very serious. It means that bacteria has infected the cornea, causing redness and of course a great deal of pain, as well as sometimes it can cause quite bad blurring of vision. So this is actually a very serious condition, especially if this infected area involves your pupillary area, the area around the center here. It can actually lead to permanent blindness. So I'll go a bit more in detail on that as well later. Okay, the other cause of red lines, which is fairly common, is what you call infective conjunctivitis, or I think in Chinese they call it commonly hong ngan cheng, or red eyes, or pink eyes, or in Malay they call it sakit merah mata. So this condition is actually infection. Most commonly it's caused by a virus. So it usually starts with one eye first, but most of the time it will infect the other eye as well after some time. So the patient may have a history of having a cough or cold, or a contact with people with red eyes because it can spread. And then the symptoms, usually there will be discharge, and then the eyes will be filled watery. And usually there's no blurring of vision, or maybe slight blurring of vision in cases which are a bit more serious. The main thing here, I think, is the discharge. You can see even in this picture here, you can see that there's discharge, yellowish discharge like this. So this is actually very typical of this hong ngan cheng or infective conjunctivitis. Okay, so coming to another case here, this one I mentioned also, allergy itself, allergy itself also can cause red eyes, as you can see in this patient. Now, in this condition, allergic conjunctivitis, we call it, usually it involves both eyes, because if there's allergy, usually both eyes will be affected. And the main symptom here is itchiness, okay? Itchiness, watery, and the eyes will look a bit mildly red or congested, okay? And usually the person will also have a history of other allergies such as nose allergy or skin allergy, eczema, or maybe even asthma. So you see the eyes are red and watery eyes and very itchy. It's very common in children, actually, more common in children than adults, I would say, allergic conjunctivitis. Okay, this is something called a subconjunctival hemorrhage. Okay, now subconjunctival hemorrhage, you can see it really does look like blood. It looks like a patch of blood on the white part of the eye, as shown in this picture here. Okay, and typically there is no pain, no blurring of vision. The patient usually will come and see the doctor because it can be quite so-called serious looking or scary looking, because it really looks like a big patch of blood on the eye. So many patients, they feel very anxious, they're scared, and they will come and see the doctor, although there's no pain or blurring of vision. Now, most of the time, no definite cause can be determined on questioning the patient or examining. But some possible causes may be trauma. It may be a trauma for actual trauma to the eye, or it can be from eye rubbing. Sometimes it can be straining from lifting heavy objects, coughing hard, or even from retching or vomiting after a bout of drinking. I have patients that come to me after drinking, they had vomiting, and then this happens. So it's actually quite common that way as well. And another thing is some people, they are like, maybe they have heart problems or they have high blood pressure. Their doctors recommend them to be on blood thinning drugs. Okay, then they may more easily get this kind of condition, this bleeding in the white part of the eye here. Now, okay, this one, as I mentioned, is quite serious looking, but most of the time it's actually it's a totally harmless condition, I would say. It just looks serious or scary, but it doesn't affect your vision at all. It's actually a harmless condition. But if the person has bleeding from other parts of the body, apart from this bleeding on the white part of the eye, if there's like bleeding from other parts of the body, like when they brush their teeth, there's a lot of heavy bleeding. There's even blood when they pass urine, or they have they easily get bruises on the body, and then they should see a doctor, get a full examination. Systemic conditions must be ruled out. Sometimes they may need a blood test just to make sure they don't have any bleeding or clotting disorder. So this condition, again, typically in summary, looks very red, but it's actually no pain or blurring vision, no symptoms actually. It's usually harmless. Okay, another condition which very common is what you call inflamed pinguiculum or a pterygium. Okay, so this pinguiculum is actually, it starts as a spot on your white part of the eye here, usually quite near to your cornea. This brown thing, this part of the eye is called the cornea here, the eye black. So usually on the eye white near to the cornea, sometimes you get this round spot here. So this is called a pinguiculum, and this pinguiculum sometimes can get inflamed and becomes quite red like this. Okay, this pinguiculum is usually can be seen associated with dry eyes, or sometimes history of sun exposure. There's no blurring of vision. It can cause some eye irritation.
No, usually I go there for gym only.
So it's a harmless condition, but it may progress to become a pterygium later. Sometimes pinguiculum, after some years, it will slowly become like this. So when it reaches the pterygium stage like this, you can see there's a growth of tissue right into the black part of the eye, into the cornea. So usually at this stage, you will need surgical excision. Surgery will be required, because if this pterygium, if this growth were to actually reach your pupil, the central area, it can actually cause permanent damage and permanent blurring of your vision. Okay, so this is another condition can cause redness of the eyes, inflamed pinguiculum or inflamed pterygium like this. Okay, this is probably not so common, episcleritis. This one typically is, you will notice the redness in just one part of the eye. In the other conditions I mentioned just now, probably it's like, the outer and the inner white, you can see redness here, but this one is usually involving just one sector. Okay, either the inner or the outer part of one eye here, like this. Okay, it can usually cause a bit of irritation, but again, no blurring vision, and typically there's no discharge. Okay, it's just to let you know, it's not very common actually, just to let you know there is such a thing. Okay, trauma means injury. Okay, now if you are talking about trauma, then of course it's a whole different set of conditions already. So trauma very commonly can cause inflammation. You see, like even like trauma, if something hits your body or your arm or your leg, usually you can get swelling, redness there, isn't it? So that's inflammation. So same, if trauma happens to the eye, it can cause a great deal of inflammation and redness, of course. Okay, and trauma can cause damage or injure any part of the eye, from the front of the eye to right up to the back of the eye. Okay, so some of the common injuries in trauma is the cornea here. Cornea being the part of the eye which is at the most front part of the eye, is of course very commonly injured. Okay, and one common injury is actually what I call a corneal abrasion. Corneal abrasion is like what in Cantonese they call jaw. It's like the erosion on the corneal surface. You see here, the example here I've shown you. This is a cornea, and you can see this yellowish patch or greenish patch here. It looks yellowish or greenish because I've applied a special eye drop there to make it clearer, give it a bit of color so that it can be seen more clearly. Okay, so this is actually an area of the cornea that has been like sort of scratched off due to the trauma. Okay, then other injuries to the eye. Injury to the eye can also be like blunt injuries, like a punch to the eye or maybe a ball hitting the eye. So this will cause inflammation or bleeding internally in the eye, or retinal injury. Here is a picture I've seen. If you look at this eye, you can see that actually inside the eye, you can see a level of blood here. This is actual blood. It's because of trauma. Some of the blood vessels on the iris here has been injured and has started bleeding. So the blood actually has collected at the bottom part of the interior of the eye here. So this one is actually medically we call hyphema. So it's actually blood in the eye due to injury. Now, if it's a penetrating type of injury, as in something sharp actually pokes the eye, of course it's usually more serious. For example, in this case here, some sharp object has actually hit this part of the eye, and there's actually a puncture there, a through and through wound, a puncture. So you can see that some of the contents from inside the eye, this brown part of the eye we call iris. So through the puncture wound, some of the iris has actually come right out of the eye here. See, so the eye from trauma is looks red, and then if you look closely, you can see that part of the eye content is actually come out through a wound here. Okay, less common causes of red eye. This is what I mentioned a bit more common. Now it comes to less common cases. Okay, this one corneal ulcer I have mentioned just now already, and I did mention that it can be a very serious condition. So corneal ulcer in our setting is most commonly related to contact lens wear, or sometimes in people who like work outdoors especially, it can be due to trauma. So usually to get a corneal ulcer, there must be a history of contact lens usage or some trauma to the eye. Corneal ulcer usually does not happen to a person who does not wear contact lenses or there's no trauma. No? So people with no risk factors or normal eyes, usually it's very, very rare to get corneal ulcer. So how would a person with corneal ulcer feel? Well, okay, usually they'll feel pain. It can be very painful. The eye is of course red, okay, and many times there's actually blurring of vision. So we call it red, painful blurring of vision. Now in this condition here, how do you identify it? Well, of course your eye will look red. And for the more observant people, if they were to look in the mirror, they can actually see that the cornea is not normal. Usually they will see some kind of opacity or some white spot or maybe a yellow spot on the cornea like this first picture here. A very serious corneal ulcer will probably look like this. The white spot or yellow spot will be very much bigger, involving a bigger part of the eye, and they can actually internally can see a level of pus. This is actually pus which has collected inside the eye because of the very severe, very bad infection here. Okay, so as I mentioned, this one, early consultation and treatment with the eye specialist is extremely important if you want to prevent or minimize any permanent loss of vision. This condition can become very serious and can lead to permanent blindness. Okay, so if you're a contact lens user, if you have any kind of redness, I think I would advise you strongly to definitely go and see an eye doctor as soon as you can. Okay, you may be able to save your vision and prevent any permanent loss of vision. If you look at the mirror, as I mentioned, you'll probably notice some abnormality on your cornea itself, maybe a white or yellowish spot like this. By the time you reach this stage, you will definitely have seen a doctor. Okay, the other condition, a bit also not very common, a cause of this red eye is actually scleritis. Scleritis, usually it causes redness in just one sector of the eye. Usually the outer white or the inner white will be more affected, and the redness usually is very intense until sometimes it looks like a bit bluish, to that extent. And usually it's quite a painful condition. In some cases, it can be actually very painful. And this condition, actually, you have to come and see a doctor definitely, because there's definitely a risk of vision damaging complications, which can occur because of this condition. And the other thing is 50% of patients with this, what you call scleritis, they actually have another generalized or body illness, maybe something like rheumatoid arthritis, maybe. So they may need further assessment by other doctors as well, maybe some internal medicine specialists. Okay, there's another cause of red eyes which is not common, of course. This will cause redness, and one of the very common symptoms is photophobia or glare. Okay, the patient will say, "Well, my eyes are red, and when I look at the sunlight or a bright light, I feel very uncomfortable. I feel very glaring. I get a headache." Okay, that is a very common symptom of this condition called uveitis. And the blurring of vision also occurs quite commonly in this uveitis as well. Uveitis is actually inflammation of the eye occurring internally inside the eye itself. Other conditions such as scleritis or conjunctivitis, the inflammation or infection is actually outside on the white part of the eye. But in this uveitis, the inflammation is actually internally inside the eyeball itself. Okay, so this can be a very serious condition leading to things like glaucoma or even damage to your retina. And 15% of these cases of uveitis, they may have other body illnesses such as SLE. Okay, so in this condition, like this, for example, here is quite a serious case of uveitis. In this case here, you can see that internally, actually, there's also a level of this whitish yellowish material, which is actually, I suppose we call it pus. It's actually due to the inflammatory material here. So this is one of the things that the patient or the person himself or herself may see if they actually are quite observant and look in the mirror. So here, the main symptom here is photophobia, redness with photophobia, glare. Okay. That's a very important common symptom here. Now, acute glaucoma. Yes, glaucoma, sometimes you can have a type of glaucoma which occurs very suddenly. It comes suddenly within 1 to 3 hours. The attack will come and become very serious. This is what is called acute glaucoma. So this one typically the eye will look red, of course, and usually it affects one eye of a middle-aged or a bit elderly person, commonly female, and also it seems to be more common in Chinese people as well. Now the symptom here is redness, of course, and then there's painful blurring of vision. Vision can become very blurred, very painful, and many times, very commonly, there is headache as well. The headache is usually on the same side as the affected red eye. Okay, so painful blurring of vision with headache. Okay, this is a very important, very common symptom for this acute glaucoma. In this condition, early treatment is very important. Okay, because in this condition here, the eye pressure goes extremely high, and you must lower the eye pressure immediately. Otherwise, it can cause permanent visual loss, permanent damage to the nerve, to the optic nerve, we call it. So you must definitely see a doctor if you have this redness, very painful blurring with headache. Okay, we will need to reduce the pressure as soon as we can. Now, thyroid eye disease, again, is not a very common cause for red eyes, but typically they will have a particular look most of the time. So the patient who comes with red eyes and they will have a history of thyroid disease, and typically the eyes will appear bulging. And if you look at the eyelids, you can see that the eyelids are actually at a higher position than normal. Normally the eyelids will cover a bit of the upper part of the cornea here. But in this patient, you can see the eyelids are actually way above the cornea. You can see the whole cornea is exposed like this. Okay, so the patient looks and he's staring at you, and the eyes actually look bulging. Okay, so red and bulging eyes. And sometimes the eyes, because of the bulging of the eyes, the eye movements may even be like restricted in certain directions, so they may end up having double vision as well. So in this condition, if the patient has got thyroid problems, and then they have red eyes, I think they should definitely come and see a doctor. Because this condition, thyroid eye disease, it can also cause visual damage from maybe corneal exposure or compression or of the optic nerve. Okay, because if the eyes are like bulging like this and your eyelids are like elevated like this, sometimes when they sleep, you may not be the person may not be able to close the eyes properly. So the wind or the exposure to the environment, or when the wind blows, the cornea part of the cornea, especially the lower cornea here, may actually get very dried up and become exposed, may even lead to infection. So if a person has got thyroid disease and then they have red eyes or bulging eyes like this, definitely they should see an eye doctor. Okay, this one I just want to mention because I have many patients actually with red eyes. They have come and they shown me that they have purchased this eye drop from the pharmacy. Well, I would not advise to use this. It's actually the pharmacist will tell them that, well, this is actually a redness removing eye drop. And many patients, they're actually very impressed because they just put one drop and within like 1-2 minutes, the eye becomes like almost completely white. Now the thing here is I don't advise to use it because one thing is that it can cause what they call rebound redness if you use it repeatedly or you use it for a long time. Rebound redness means that if you keep using it, after some time, if you don't use it, you'll find that the redness becomes more and more frequent and does not actually go away anymore. And even then, if you keep putting, after some time also, it will start to become not so effective. The redness also does not go off so easily anymore. Okay, so that's one of the things that cause what we call rebound redness. And then second thing is this is actually symptomatic treatment. They're just trying to remove the redness, but you are not treating the underlying cause. You see, you must find out what is the cause of the redness, what is causing the eye redness, and you must treat it. So for this, of course, you would definitely have to see the eye doctor. And then if you were to just continue using this to remove the red eye, this may actually mask the underlying disease. You put this, the redness goes off, so you may think, oh, actually there's nothing seriously wrong with my eye, see? So you may delay in seeking treatment, whereas the actual disease is still going on. So yes, I wouldn't advise using this kind of eye drop, this kind of redness removing eye drop. Okay. Okay. When is it extremely important to see an eye doctor? Okay, probably this part I think is you all probably can try to remember, because the earlier ones, some of those conditions then may be a bit rare and maybe a bit difficult for you all to remember. Okay, So basically, when is it important to see eye doctor if your eye is red? Okay, number one, of course, blurring of vision. Your eye is red, you have blurring of vision. Yes, I would say it's very, very important to see a doctor. Your eye is red, blurring of vision can be many causes. As I mentioned just now, some of the dangerous things can be like corneal ulcer, especially if you are a contact lens wearer. Okay, or it can be acute glaucoma. Yes, painful blurring vision with headache. So that's again another condition where if you don't see a doctor, you risk permanent blindness. Okay, so blurring of vision, red eye, definitely see the doctor. Pain also is another very important symptom. Okay, because pain usually means that there's a high risk of eye undergoing damage there. Pain, again, those painful conditions I mentioned as well. Corneal ulcer is one of them. Acute glaucoma also is one of them. Other conditions like scleritis also is one of them. Scleritis also can cause visual damaging complications as well. So pain, especially if headache, pain, again, that's glaucoma. You must see a doctor. Photophobia, glare. Sometimes you feel, wow, why am I so sensitive to light? It's red. When I look at light, I have headache, I feel very glaring. So this may point to some inflammation like uveitis. Uveitis, again, it has to be treated because it can also cause other complications such as glaucoma or even retinal damage as well. So again, photophobia or glare is another symptom that you must see a doctor. Sometimes instead of glare, some patients when they look at a light or a light bulb, maybe they may see like a rainbow colored ring around it, what we call a halo. That may actually be a symptom of something serious. That may be a symptom of early acute glaucoma, a type of glaucoma. So in that condition also, I would definitely advise you to see a doctor. Redness of the eye, if you are a contact lens user, yes, definitely you must definitely see a doctor. Okay, because there's a risk of developing a corneal ulcer if it's not detected early. And if you have systemic illnesses or other general body illness which may affect the eyes, which I mentioned just now, like thyroid problems or autoimmune diseases, for those rare patients who have this condition, I'm sure they'll know what I'm talking about. Autoimmune diseases such as SLE, connective tissue diseases, Crohn's, ulcerative colitis, all these things, they are known to affect the eyes as well. So if you have any of these conditions and your eye is red or you have any eye complaints, please do see an eye doctor. Of course, trauma, if your redness is due to any kind of trauma, be it blunt trauma, penetrating trauma, or chemical trauma, yes, definitely I would suggest that you see the doctor as well. So, okay, I've talked about red eye, and some of the terms I know is you have probably all of you, a lot of you are not familiar with, but I hope that you can at least understand the basic message that I'm trying to convey to you, especially on this page here. Why is it important to see an eye doctor if your eye is red? Okay, take home message here. Red eyes, many of the red eyes, they have actually potentially blinding consequences. That means many cases of red eyes, they're actually dangerous. Okay, and you actually need early consultation and treatment with the doctor to prevent permanent damage to vision. Yes, some conditions, they can cause permanent damage to vision. If you see the doctor too late, start treatment too late, yes, you may still end up with some permanent damage to your vision. And then not all cases of red eyes are conjunctivitis. I know that is supposed, or red eye infective conjunctivitis is supposed to be something is quite common, and that's the thing that most people will think of when their eyes are red, okay? But you must understand that not all cases of red eyes are conjunctivitis, okay? And you should not rely on over-the-counter eye drops. That means going to a pharmacy and just pick up something that the pharmacist recommends, because it may have dangerous side effects. Some of these drops actually have dangerous side effects, and they may not actually be correct for your condition as well. So again, I think the best option I would say definitely is to go and see an eye doctor if you have any redness of the eyes. Okay, so this comes to the end of my presentation. Thank you very much, everybody. So
Thank you, Dr. Lim.
Okay, thank you very much. So if you have any of you have any questions, I'll be happy to try to answer them for you.
Yeah. So, okay, for those attendees who actually join us live in a Zoom session, if you have any question, You can either raise your hand and unmute yourself to ask Dr. Lim's any question. If not, then I will. Okay, we have one question from Man Yi. Can chronic skin problem like eczema, dermatitis cause red eyes?
Okay, very good question. I did actually touch a bit on it earlier on. Eczema, dermatitis, actually they don't cause red eyes, but they can be associated with red eyes because one of the causes of red eyes, as I mentioned earlier, allergic conjunctivitis. So eczema, dermatitis, these are typically allergic conditions. So the person is simply, I would say, is an allergic person. So as such, this person, if he has got dermatitis and eczema, I would say he's also got a high probability of having allergic conjunctivitis as well. Okay, so what's the normal treatment? If you are referring to the eyes, allergic conjunctivitis, I think of course first thing is to try to remove or avoid the thing or the factor which is causing the allergy. Now that can be something in the environment that can even be related to food or sometimes related to contact lens wear. But most of the time, from my experience, actually, it's not easy to actually find out what is the cause. You see, sometimes you may need to see the skin specialist, go for allergic tests and all that. Okay, but in terms of treatment for the allergic conjunctivitis itself, well, usually I think the symptoms will be the use of eye drops, that's what we call antihistamine eye drops. These antihistamine eye drops, a good one will also have what they call a mast cell stabilizing effect, which means that as you use it over time, not only your histamine, not only is it antihistamine, but your mast cells, those cells will release histamine actually become more stable and they become so-called less sensitive or less allergic. So if you use it for some time, actually your allergy, the eye allergy itself actually tends to become less. Hopefully, eventually it will go off. So the treatment is actually yes, using antihistamine eye drops. That's the first line.
Dr. Lim, since
Yes.
you're talking about the antihistamine eye drop for this for this kind of problem, does it also help like for those people who have sinus problem? Does it also have the same impact? We have this kind of allergic on the eye.
Sinus problems, in general, I don't think that they will be affected or treated by these topical eye drops. Because these topical eye drops are instilled into the eyes and they are absorbed by the eyes and they are actually meant to treat the eye condition. For this allergic rhinitis, sinusitis, all that, I would say you will probably need to see the ENT doctor, and sometimes for cases which are necessary, they may prescribe like nasal sprays. So yes, in general, I don't see eye drops. Sorry?
For the sinus, which will actually, I mean, for those people with sinus, would it also cause allergy eye? Will it
I
also
see.
related?
Yes. If they have an allergic nose condition like allergic rhinitis, then yes, they have a high probability of having allergic conjunctivitis as well. So it's like the allergic rhinitis or the nose allergy is actually it's associated or comes together with the eye allergy. Some people some patients ask me, is it my nose allergy causing my eyes allergy? Actually, the answer is no. It's just that they occur together because you are an allergic individual, so you have these two conditions together. It's not that the eye allergy causes the nose allergy or the nose allergy causes the eye allergy. It's an association.
Okay. Dr. Lim, we have one question from our Facebook attendees from Eng Kun Lei. Okay, I will read to you. Is there a mild glaucoma as opposed to acute glaucoma? If son, that means son as in his child, need treatment for the mild one. I think he's thinking about the glaucoma. So I don't really quite understand the question.
Okay. Just now when I mentioned, okay, just now when I mentioned the word acute glaucoma, actually the word here acute is does not mean serious as in compared to mild in that sense. It doesn't actually mean serious. When I say acute, it means sudden. That means what I'm saying is that this acute glaucoma is a type of glaucoma which comes on suddenly. So it comes on suddenly, and also yes, it also happens to be serious. Now, if you say like mild glaucoma, well, medically there's no definition for mild glaucoma actually. Maybe if you want, if he can like I mean go a bit in more detail what actually it means, then maybe I can try my best to answer it.
Yeah. So Ankune, probably if you can elaborate a bit more on your question. We have another question from Mark Manyi again. When will removal of eye membrane needed in red eye disease?
Okay, yes, membrane here, I suppose she's talking about infective conjunctivitis. Some cases of this conjuncting or infective conjunctivitis, some cases which are serious, yes, you can actually get something which looks like a membrane growing inside the eye. Okay? Now, usually, if the membrane is thick, sometimes when the doctor, if I look at the membrane, it looks quite thick, and I think that it will cause like irritation or erosion to the cornea, then I will actually physically remove the membrane. The reason for doing is that it will cause sometimes the membrane is thick. It will also disturb the absorption of eye drops which you put into the eye to treat this condition. And then if the membrane is thick, also it will cause like it will be constantly rubbing on your cornea and may even cause corneal erosions. So yes, usually if there are membranes, I would remove it.
All right. Before we go to the other questions, to all the attendees who are actually online via Zoom, either or via the our Facebook Live or YouTube Live, just to let everyone know that we for all the RNC eye screening, including the doctor consultation, later we will send a link for you to register for the free eye screening. Okay, so just stay online with us while we have this Q&A session. Dr. Lim, can I ask you,
Sure.
can actually stress causes the red eye?
Stress. Stress.
Yeah.
Stress. I can't think of any reason why it causes red eyes unless like if you mean like in word stress where you have to spend a lot of time in front of the screen and all that. Well, then it can cause red eyes through dryness, digital eye strain. But as in stress itself, I can't really think of any reason why it should cause red eyes.
Okay. What about the usually like some of them they do sports, and then will they actually have this problem where, or they go swimming, so after a swim in a pool, or when they sweat and then the sweat actually went to the eye and then it turned red. So is it something alarming for them that they should actually go and consult an eye doctor?
Well, if after like for example, if they're gone swimming and then after that they climb out the pool, the eyes are a bit red, but otherwise okay. I mean, no, like it's not excessively itchy or painful. I suppose a bit of redness after a swim is normal because there are like chemicals and chlorine in the pool water, So some of them can be like a mild irritant. But if it's like happening to quite a serious degree, like the eyes are really very red and itchy also after the swim, then well, they could be having maybe allergic conjunctivitis. Probably you will need to see a doctor to confirm and maybe get treatment. And then sweat running to the eyes, of course, sweat has a high concentration of like salt and all that. So sometimes it can be a local irritant. So yes, something it may cause a bit of redness as well.
So in this case, Dr. Lim, like for those who are having red eye, if they have it like continuously for 2 days or 3 days, usually like what a cutoff point where they should actually how to say, consult a doctor. I mean, a lot of people will just take it very lightly, and then they will have the red eye sit in for like 3 days, 4 days, then only they come and see a doctor. So what would be your advice, a cutoff time frame that they should actually don't wait and have to come in and see a doctor already?
Okay, I think more important would be to remember those symptoms I told you about, where it's extremely important to see the doctor, like blurring of vision. If you have pain, that's one thing. Pain, blurring of vision, especially if you have headache, I think you should see a doctor immediately. And if you're a contact lens wearer, Otherwise, some things like one of those conditions I mentioned is not the subconjunctival hemorrhage, where there's like a patch of blood on the eye. Well, usually that condition, there's no pain, there's no blurring of vision, you just see a red patch. Well, that kind of cases, probably, I think most people, they may wait a couple of days before they come. I think more important is to go by those symptoms which I mentioned, pain, blurring of vision. You have contact lens wearer, I think those things are very considered more important.
And one more question
Sure.
from the Zoom attendees from Agi. During this period of COVID-19, has the cases of conjunctivitis increased?
Honestly, no. We still see the I think more or less the same number. COVID infection can present with conjunctivitis, actually, it's known to, but it's kind of rare. So far here, as far as I know, there's no there haven't been any increase in the cases of conjunctivitis.
Okay. Okay, Dr. Lim. Now, because you're talking about the red eyes and like those infectious like that, you know.
Yes.
Would all of it contagious type? I mean, how do they know, or any precaution that they should actually be taking care before consulting the doctor?
Yes, actually, good question, because yes, many patients with infection, they usually ask the doctor this question. Yes, this infective conjunctivitis or yes, this is actually a very contagious condition, but there's also a lot of misconception associated with it. Many people think that it's spread just by looking at a person with this infection. Actually, it's not true, because this infection, this red eyes, actually spreads mainly by contact, by touch. Actually, touch is what I mean by touch is that there must be actual touch with the virus causing this condition. Most of the time, if the patient with the red eyes, if they touch the eyes and they don't wash their hands and there's virus on their hands, they touch other objects like maybe the table, the door handle. Other people touch those same objects and they touch their own eyes. It may spread that way. Sometimes for example, if they lie on the pillow and then they have the tears, the watery secretions all on the pillow, and somebody goes and lie down there in close contact with the pillow, then of course the virus has a possibility of spreading to the other places as well. So here mainly I would like to tell you all that it spreads by touch, but not by looking at like people with red eyes. That's a very common misconception. Now, how do you prevent this? Obviously, now you know it spreads by touch. I think the main thing here is hygiene. So don't always keep touching the eye. If you need to wipe your eye, I think you should just wipe with maybe a tissue and immediately dispose of it properly, and then always wash your hands. I would say that's most important. Okay. Sorry, I think a bit of interruption. No. Sorry, Anna, I can't hear you.
Just have to take care of the hygiene very well.
Yeah.
Okay. Oh, sorry. Can you repeat the question? You mentioned that you dropped. All right, because it will cause more harm. Yeah. Okay, I guess today the internet wasn't good. Can you hear me better now, Dr. Lim?
Okay, now I can hear you.
Dr. Lim, can you hear me?
Yes, I can hear you now. Can you hear me? Can you hear me? I think I can't hear you now. No?
Sorry, Dr. Lim, can you hear me?
Yeah, can hear you, can hear you.
Sorry,
Okay.
just now.
Okay.
Okay. My question again is just now you advise if for the patient you don't advise to actually get the eye drops,
Hello.
right? So what would be the worst scenario?
Sorry, do you mind repeating it, because part of the speech was not audible. Hello, sorry. Sorry, I couldn't hear you just now. Hello. Sorry, I can't hear you.
Okay, can you hear me now?
Okay, now it's okay.
Okay, all right. Just pray that the internet is good tonight.
Yeah.
I guess there's too many webinars around. That's why
Possibly.
internet actually went crazy. Okay, so this is the last question actually. Just now you mentioned that for those, I mean, you don't advise the patient go to the pharmacy to buy the eye drop.
Yes.
So, what if, let's say, patient ignorant still go and buy the eye drop? What would be the worst scenario what actually happen?
Okay, well, yes, okay, well, if, for example, if they have a corneal abrasion or a corneal ulcer, if they were to use a type of eye drop called a steroid, well, usually that has a high risk of making the condition worse, very much worse. So,
Okay.
So that can actually lead to something very serious, which can actually be causing loss of vision. Huh? So yeah, so using a wrong eye drop like a steroid eye drop in the cases of infection may actually lead to corneal ulcer, okay, which is a very contagious condition. Sometimes some patients, they use the eye drop for a long time. Those are what you call steroid eye drop. If they use it for quite a long time, or it may not need to be that long. Maybe after more than 2 weeks, if they were to continuously use it, then there's a risk of developing a also glaucoma.
So it's strictly with doctor's prescription, right?
Yes,
Advisable,
yes.
because all these are with steroid. Because I understand there are a lot of people out there. Oh, this time round I get the prescription from the doctor. I definitely cannot finish because probably I only need to use for a week or 10 days.
Yes.
So keep the eye drop.
Mm-hmm.
I mean, in the near future, maybe 3 months or 5 months down the road, they have another round of infection. They will apply the same eye drop again. So,
Yes.
so in that case, actually, the eye drops, they shouldn't be using back the same eye drop, right?
Yes, definitely they should not be using back the same eye drop. You should always just get a doctor's consultation first.
Because every time would be a different
Yes, it could be a different condition. And also, it's not advisable to use eye drop which you have opened and been around for like 5 months or 6 months, because it may already have been contaminated with the bacteria and or God knows what else. So if you're putting the eye, it may actually make infection worse.
Okay. So is there any more other questions from the attendees from the Zoom or the Facebook? Any more questions? You all see the link on the chat, the Facebook or the YouTube chat room. We will send the link for the registration. Okay, we got one more question from Chris. Okay, Chris. Okay, Dr. Lim, this is a question from Chris.
Okay.
She said, my work required me to face laptop almost 24/7. And I'm a contact lens wearer. Is the 20-20-20 rules is good enough, or are there any other tips I can use?
Well, the other thing is, if you're a contact lens wearer, I would say very, very high likelihood you also have dry. So I think you should be putting regularly a lubricant, basically an artificial tear. You should be putting regularly, like probably like every 2 hours, to elevate the dry eyes. Apart from the 20-20-20 rule.
So is there any? Okay. So artificial tears will actually help to lubricate it, lah. Yes,
and also don't forget that if you want to I mean, avoid the use of contact lens. You can always consider doing what you call a LASIK procedure. Okay, this will remove your refractive power. That means you don't need glasses or contact lens anymore. So if you don't wear contact lenses, then of course this will help the dry eyes a lot. That's one thing that is worth considering.
Okay. Okay, we have one last pop-up question from our Facebook attendees. Is blurry vision as a result of dry eyes?
Blurry vision can be a result of dry eyes. As I mentioned just now, in those causes of dry eyes, some doesn't cause blurry vision, but some can cause blurry vision. Those like as I mentioned, corneal ulcer, uveitis, acute glaucoma. Yes, some conditions of causing dry eyes can cause blurry vision. So in those cases of dry eyes with blurry vision, it's even more important to see an eye doctor, because those blurry vision is actually a dangerous sign. So usually you must seek early treatment consultation.
So that's the question from Lim from our Facebook. So if you have blurry of vision, just have to come and consult the doctor to diagnose what is your actual problem. It may not just be only dry eyes, right, Dr. Lim?
Yes, correct, exactly.
So for those attendees, you can click your link for the registration. Don't worry, you don't have to do it now. You can actually do it. The link will be open until tomorrow evening at 5 p.m. So you can do the registration for the free eye screening for tomorrow. Now, for those who actually would like to join us, I think we have quite a lot of requests from our attendees who have been joining our webinars. Our next webinar will be on the 14th of January. So it will be in a Chinese or Mandarin Cantonese version. 爱眼睛护眼睛从幼到老 Sorry, my Mandarin is not very good, okay? So please excuse me. So for those who are interested to join us, okay, please follow us on our Facebook. Remember to like, so get the notification, and then we will send you a registration link. So if you would like to have a direct interactions, you can join us at our Zoom live session or our Facebook live and YouTube live session as well. So this will be our next webinar, upcoming webinar in January, 14th of January in 2020. Okay, so 2021, sorry, 2021. So thank you, Dr. Lim, for having you tonight and sharing very insightful informations about red eye. Actually, red eye is not just only typically red eye only. So thank you all the attendees for taking your precious time to join us. All right. So we hope to see everyone in our next live session. So wish everyone Merry Christmas and Happy New Year. Be safe and take care. Thank you, Dr. Lim. Thank you, everyone.
Thank you, everyone. Bye-bye.
Thank you, Dr. Lim. Thank you.
Thank you, Doctor. Thank you, Doctor. Thank you. Good night.
Good night.
Okay, good night, Doctor.
Good night. Good night, Dato. Good night, everyone. Good night.
Well done, Eng Hock.
Thank you very much, Doctor. Thank you very much.
Very nice.
Thanks, Doctor. Good night, Doctor.